Okay, hello.
Hi.
This is Dr. Karen Herbst. My name is Deb Palshay with Vibration Guide, and we've been blessed today. Part of our Lipedema awareness initiative this month is bringing some awareness. And I just couldn't think of anyone better to talk to than my friend Karen, who I heard about this from kind of the first time about 3 years ago when I met you at FDRS. I kind of thought I had a clue, but I had no clue. So I've kind of been obsessed myself with it ever since because Eureka, I think half my clients over the years that I've dealt with have this or symptoms of this. And there's things I'm beginning to recognize that I maybe wouldn't have noticed or paid attention to had I not had access to your information and your resources. So what are some of these fat disorders? There's a number of them out there. Some are maybe a little bit more well known than others, but what specifically are fat disorders? If you could give me a common, easy explanation for our viewers out there.
So a fat disorder would be one where fat grows on the body, not entirely in relationship to diet and exercise. So we all know that if we eat too much or don't exercise enough, we can grow fat. And then if we in turn eat less or eat better and exercise more, we can lose it.
Correct.
So that's quote unquote like normal fat. Then the abnormal fat in fat disorders, it'll grow as lumpy fat usually, like a lipoma, a small nodule. And when you go and try to lose that weight by diet or exercise, then, sorry.
No worries.
As living at home, what can I say?
I hear ya.
So, so it grows in, the feel to the fat is different, and the ability to lose by diet and exercise is different. And I'm not saying it absolutely can't be lost by diet or exercise or other means, but that's something that we're really trying to make happen. Okay. And I'm sure everybody would like it to happen that way. Some of the disorders that we include in fat disorders are lipedema, which occurs primarily in women. Usually affects from the waist down or the arms. It spares the trunk, hands, or feet. And then there's Dercums disease, where you get lumpy fat. Usually we call it lipomas on the trunk, which differentiates it from lipedema. Okay. But also on the upper leg and on the arms. It can also happen on the back. In rare circumstances, it can happen on the head, the hands, and the feet. Okay. There are a lot of other fat disorders that I'm not going to talk about today, just because there's too many. There's all sorts of different lipodystrophies. Yeah. And there's also Madelung's disease or multiple symmetric lipomatosis. There's familial multiple lipomatosis. But I think if we just focused in on lipedema, Dercums disease, that would be great. Those are both, those are the painful fat disorders. Not saying that the others, aren't painful, but these two are known for their pain component. Okay.
And probably some yet to be discovered, to a degree.
You know what? There's probably all different types of lipedema that we just, are unable to distinguish from one another right now. And I know for a fact that there are different types of Dercums disease. And I've tried to point that out, I guess. And I have a book chapter. It's on endotext.org. And people can go there and download it for free.
Awesome. We'll recap some resources in comments today because we will be covering some information, and I'm certain there's going to be people that would like to know more. So I'll cite your website and ask you to give me some confirmation of that at the end, just so folks can visit for more. So that there seems to me to be a lack of understanding. I'm a vibration trainer. I've specialized in that, not the expertise that you do, but I feel sometimes even I am talking to therapists, massage therapists, advocating for my clients, and they look at me like I'm crazy. So there seems to be a misunderstanding, and in some cases, I would even think a misdiagnosis. Why are these conditions not more widely known? Is there an answer for that question?
Oh, maybe. I think that as we have gone through a medical school or other kinds of training, you think about the fat as just a storage organ for fat. Yeah. And we don't think about it as an endocrine organ, which it is. And we also don't think about it as something like good. We think about it as something you got to lose. You got to get rid of that fat. And so there's an anxiety component to it. There's a fat shaming component to it. Even they've done studies on healthcare providers, and healthcare providers fat shame patients. And we fat shame each other, you know, on social media and in comic strips. So I think it's been a scary topic. No one wants to really talk about fat as something useful and important, and that we can reshape our bodies if we try and if we have the right tools. Do we have all the tools? No, we don't. And we're just learning right now what we're actually doing with the tools that we have.
Okay.
So I would say there's just a lack of education. Like when you go to an autopsy, and you know, in medical school, we'd go to an autopsy and they would take all the fat away and then say, okay, let's look at the important stuff. And I went to an autopsy on a patient who died with lipedema, Dercums disease, both of them. And they kept chopping away the fat. And I was like, wait, can I have that? Wait, stop. No, you know, and they wouldn't listen to me. They just couldn't understand why fat was important. And it gives us fat gives us our shape, our beauty, our curves, you know, as women. So
not to get too religious, but you know, I think somebody probably put it there for a reason and a function.
Yeah, and it helps cushion. Like when someone touches you, they're not touching your muscle directly, unless you're like totally a cut person. But as a woman, they're not touching your muscle directly. So an impact, it helps with impact. When something hits your arm, that fat gives us some sort of mechanical protection. It also just kind of helps lubricate everything.
That's a great point. That's a great point. And I think much like my world too, awareness is key. But sometimes even to be bold and say re-education. You know, we think we know, and you know, even within your community, you know, because it is a relatively unknown condition, you know, there's opinions to a degree, but I do feel you've really done such a huge, you know, this is a pat on the back for you. You've really created so much more information in the time you've been working with this. When did you start looking into, you know, when did this start becoming a concern and an obsession in your world? When did you start becoming aware of fat disorders?
When I was like 3.
Okay.
And I used to go shopping. Yeah, I used to go shopping with my mother, and we lived in a small town in Iowa, and we'd go to the corner grocery store, which is very small, and I'd watch the women shop for fruit or vegetables, and they would reach out and they'd have this big hanging fat on their arm, and they were so slow and delicate, and it was like a Zen moment for me, and I was just entranced by it. And I just wondered, like, why does her arm look like that? Yeah. And then my own grandmother on my father's side had some obesity, and she lost some weight. She got injured, lost some weight, and she had hanging fat on her arm. And so, and I was pretty obsessed with her arm. And I have my own, you know, fat issues, as you know, a lot of people do. And I have some fat that can't be lost by diet or exercise. And so I ask people, you know, especially my mentors and, you know, scientists and doctors and nurses, why, you know, why can some fat be lost by diet and exercise and some can't? And they all told me there's no such thing. And if you tell somebody who has fat that can't be lost by diet or exercise that there's no such thing as that fat, what does it make you as a person? Yeah. That makes you unimportant, non-existent, and you're lying to yourself. And so, well, I knew that wasn't true. I knew I had what I had. And so I just searched for, you know, some place where I could hear about that fat and learn about that fat. And I became an endocrinologist because you can help people who have obesity, and you can help people who have cholesterol programs, which is blood fat. And I met people who had lipodystrophy, and they had lost fat on some parts of their body completely. It was gone. They had no fat like on their arms and legs, but they had a lot of fat on their abdomen that they couldn't lose by diet or exercise. And they were said to have a fat disorder. And I said, I'm home. I'm finally home. Here we are. And I jumped in. And it wasn't till, so I finished my fellowship in 2002. And it wasn't until 2005, where I wrote a protocol to include the fat disorders, lipedema, and Dercums disease, which nobody really believed in this country.
Okay. Yeah. And it's probably going to be, in my experience, a long time. I feel like sometimes even over the phone, I'm talking to women, not because they're calling me because of lipedema, but they bought a vibration machine. And I'm like, do you have any soft pockets behind the back of the knees? Can you text me a picture? Like, you've planted a seed. And, like in my work, you can't plant the seed and be the harvester and be the great, like, you can just keep planting seeds, and hopefully those seeds will get some root and come to fruition. And the biggest thing I will say about your community in the time that I've spent in it, it's very welcoming. You feel there's no, as a woman, regardless, everybody's got something about themselves that they'd change if they could, but there's I think the biggest thing I feel with the FDRS group and so many of the initiatives you started, I feel like I belong. I just, even if it's just listening to each other and getting these things off your chest. Something very important you said, when something is not acknowledged, or you're getting that look like you're crazy, it's the oxidative stress. Sometimes, that pity party will combat or contribute to the weight and the stress and the anxiety, and sometimes demotivate us from looking for those answers. So thank you. Like I say, I felt your energy right off the bat, but the whole group, it is just such a supportive, educating environment. And, I understand the answers aren't all there, but just being a part of that journey with others is the biggest thing I think we as women can empower each other with. And men, this is not just,
right.
It's more common with women. We tend to have higher body fat percentages. We struggle with the weight and the marketing. There isn't a Cosmo for men. If you went and looked at all the magazines at the grocery store, they do. Many of them set that mindset very young. And I was always a very, very big girl. I have a lot of people look at me now and say, well, where are all your fat pictures? I'm the one hiding behind everybody in the picture. But same thing, up until I even got into these vibration machines, I thought it was my fault. It was genetics. I like bread. I come from a German background, and, I was always very active. And I ate okay, but I've learned, even through some of your information, there's eating for my body type, and a carb can be, there's simple things that people struggle with, and the food piece is hard. And I think we beat ourselves up on that. So my next question actually was leading into that. One of the key components with combating is, we all know diet and exercise. I don't like using the word diet. It's like workout. It's a negative to me. So responsible food choices. And I don't like to use the word exercise or fitness, because in my experience with this group, that's just a dream for some. The first goal is to start moving and feeling better, and maybe some of that will come, but traditional exercise can be an uphill battle. Whole body vibration is one of the things that you recommend as a form of activity, and for some even over regular exercise. What made you aware of these machines and go on to suggest it to some of your clients?
So way back in the 2000s, I was looking for a way to improve lymphatic flow.
Okay.
And I looked for any kind of, exercise modality. I knew exercise improved lymphatic flow, but, I had some patients in wheelchairs and some patients who just had trouble walking. How was I going to get them to exercise? And maybe they had an open wound and they couldn't go to the pool. So what could they do? And I first started out telling them that they can shake their arms and just shake. And that actually has been proven to move lymphatic fluid.
I bet.
But who wants to stand there and shake? You do it for like 30 seconds and then you're kind of done, and you lose the ability to focus on that. So I don't know how I happened upon whole body vibration, and I knew that the minute I did, I knew it made sense to me. Okay. And I looked to see whether it improved lymphatic flow. I couldn't find anything. So I translated whole body vibration and lymphatic into German, and then I searched on the internet using those German words and found the English paper on that. So somehow I didn't find the
It's a
correct
hard one to find. Yeah.
I know. So, you know, and since then I know that there are other papers, but, you know, for me, it improves muscle mass, you know, super important, because if you have problems with your fat, you have a lot of fat, like on your thighs, your knees, your muscles also have a lot of fat in them. So they're not doing well either. So you have to improve the muscles. You want to improve lymphatic flow. You want to improve blood flow. Whole body vibration does all that. It also improves bone mineral density, important for a lot of women, you know, especially European women and Asian women. And then over time, I'm sure that it improves or decreases fat. It's just that in order to do that kind of study, it would be super expensive. Yeah. So they haven't done it. They've done, you know, more short term, and first your muscle mass improves, then you start burning down the fat tissue. And more recently, this is, you know, jumping till, you know, like last week. Yeah. But, you know, we now think that the fluid in lipedema sits inside of the tissue, and it's bound up to these glycosaminoglycans or glycoproteins, which just means a sugar protein. So it's a bunch of sugar bound up to a protein, and it forms like a kind of a tree or a jellyfish shape, and then that holds onto water. And that water is not free to flow. So it doesn't flow down to the hands or feet with gravity. It just sits there bound up. And that isn't really good for the cells in that area, because the cells are trying to get oxygen, and there's all this water and electrolytes and glycoproteins in between them and their oxygen source. So they send out signals saying, help, I need more oxygen. And the body starts creating vessels as fast as it can. And those vessels are very leaky. And that leaks more fluid into the space in between cells. And it's just kind of a vicious cycle. Ripple effect. Yeah, and immune cells start coming in. So it becomes an inflammatory condition. And then the body's like, forget this. We're just going to fill it in with a scar. And you get what we call fibrosis. So it's a binding of water, low oxygen, inflammation, fibrosis. And that forms like a lipedema leg, or that forms a lipoma right there. So we have to address all the components of that tissue with exercise in order to improve that tissue. So you have to take that water that's bound up to glycoproteins in a gel, and you have to break it up. Well, how do you do that? And there's not a lot of data. I'm looking for it now. I've seen some papers, but I believe I found one paper showing that vibration actually changes the gel in the tissue and makes it a liquid gel. Yeah. So, you know, if you take Jell-O, it's nice and solid, but if you heat it up, it becomes liquid. Yep. So we think whole body vibration actually changes that to a liquid. And if you change it to a liquid, then you can move some of that stuff out of the tissue. Yeah.
And I would think, you know, in the severe cases in that situation, you know, even if it's not a physical activity, even a massage therapist or someone manually manipulating those areas, I've seen where they use it as a pre-treatment even for a massage and get so much more lymph volume. I don't know if you remember, and if she's watching, I forget your name, but 2 years in a row, we did 10 pounds the first year I was at FDRS, and 13 pounds of liquid in a 24-hour period. Just her standing on the machine for 10 minutes. She forgot her lymph pump. And I remember she come running over to the booth, and I said, well, I know, just stand on it for 10 minutes. And of course the bathroom breaks began. And, you know, so, you know, my validation, a lot of where my experience with lymph comes from is, you know, the study for lymph has always been frustrating. There's a lot of medical conditions that want to see lymph improvement. You know, there's many conditions on its own besides fat disorders, but it's, again, it's something I find it's not terribly profitable to invest sometimes in other things than pharmaceutical, or, you know, it's whole body vibrations as a research body. There's lots of research out there, but, you know, lymph to a degree to me is a common sense thing. When we move, lymph moves, circulation is enhanced. And two of the biggest things, regardless of where anyone is starting, if those two components can at least begin, you know, to your point, you know, if this is liquefying or softening that fat tissue in any way, and we can expedite, you know, anything from detoxification, there's a whole process. And most people with these machines, I find, you know, can use them in some way, shape, or form. So to not take over the question, but, you know, for me, where this is a viable option for many, it's the low impact. You know, if you want to call it an exercise, it's less impact than walking. But if you can't walk, or even if you can't stand for long durations, you know, you could get those lower legs going, even seated in a chair, you know, and maybe stand up for a minute or two.
And I could see doing whole body vibration before you go exercise. Like I'm going to go for a walk, but first I'm going to liquefy my gel. Then I'm going to go out for my walk, because then I'm really going to pump my legs when I walk, and I'm going to move that out. I'm going to do whole body vibration before my manual therapy. I'm going to do whole body vibration before my pump. So all this needs to be tested, but like you said, it makes common sense.
Yeah.
You have to do something to liquefy it. Whole body vibration does both. It liquefies plus it improves lymphatic flow. So it's doing both. But if you're only going to do a minute or 2 minutes or 10 minutes, you know, then it kind of makes sense that you might want to do something else in addition to.
Or for those that have the luxury of a machine at home, like you and I, sometimes more often, you know, a lot of the ladies that I deal with that are that stage 3, stage 4, I believe there's a stage 4, not everybody believes that, but to a degree, you know, where we're that heavy and it's a pain issue, many of my gals are using it sometimes hourly for a minute or two, you know, just as a warm up before they get to the bathroom or the refrigerator. And, you know, it can be an exercise. To me, exercise on the machine is, we're pushing ourselves. We're pushing those squats. We're doing fitness type positions.
Right.
But simply standing, sitting, or putting your feet on the machine, you know, this isn't a separate thing to do on top of everything else you're doing. But to your point, a minute or two here and there in complement as a catalyst, you know, the optimal outcome will be better. But there's also the recovery aspects too. So maybe you have gone for a big manual massage and now you're all lethargic. The other big thing, and I talk about a lot of soft benefits. To me, soft benefits are things that there is no research, but anybody who's been on this or played with them to a degree has experienced it. And, you know, we don't know why, we don't know how, it just makes us feel better. It gives us more energy, more mental clarity. A lot of times myself, you know, if I'm doing late calls or I've got a few in a row, sometimes I get on it for a minute just to clear my brain. You know, it's something different for everyone. And the big thing I wanted to focus on today was your support, but people need to understand, get the word exercise out of your head. You know, that this can be your lymph pump. It can be your catalyst. You know, it's an enhancement to what you're already doing. And if exercise is possible, it's more about you as a person. If you're physically able to exercise, then we can progress and do more things. That's kind of with any medical condition, kind of the way I take it.
Can I mention something about the stage 4?
Please.
So, yeah, we just turned in our ICD-10 codes for lipedema, and we're trying to get rid of as much confusing language as possible.
Cool.
And
okay.
Stage 4 is acceptable if you have stage 3, because then you're stage 3 and you've got some stage 4, which is another term for stage 4 is lipo lymphedema.
Yes.
But if you're stage 1 and you have lymphedema, do you call her a stage 4 too? So she's a stage 1 and a stage 4. So we find that confusing. I'm sure patients find that confusing.
As I do
We're
too.
trying to just switch to using lipolymphedema.
I like that. I saw that on your site, and maybe there's a reason I brought that question up. So thank you for clarifying, because I've been asked as well. You know, and some people think it's actually two different things.
Yeah, so I think there's a lot of publications that mention stage 4. We're just hoping that, at least in the US, that we all, you know, change to just using lipolymphedema. So you could have stage 1 plus lipolymphedema. And the lipo means it comes from the fat.
Okay.
So if you have, for example, venous disease causing an edema, that would be a different term. And that needs to be developed, and the American Vein and Lymphatic Society is working on that.
Awesome.
I know American Society of Plastic Surgery is working on another part. We just wanted to make sure that there were codes for lipedema, and we got that done. It's turned in. There's now going to be a comment period. They'll open it up. People can actually look at it and make comments. So if everyone wants stage 4, we could always go back to it. I just find it.
No, I think it makes more, because, some people can, be living with a certain condition their whole life, and due to a medical procedure or something else, develop the lymphedema as well, right? So no, I think I noticed that on your site. It's again, it's one of those gray areas in like my world. There is no handbook for this. And in some respects, I'm glad to a degree, but things will change and adapt and become, labeled once they're a little more understood. And again, most of the references I'm talking to about today are from your site. I think probably, there's some recommendations as far as, there's different types of machines, there's different price points, and perhaps, instead of dissecting all the machines today, I like to think I'm the expert in that area, and I am going to share this with a number of colleagues through social media on some groups. And I think what I may do is perhaps we can get together for another call and get into some more specifics about the lymph, things that we might suggest, how often do I do this? Can I do this if I'm also dealing with a new knee or a new back? Because one of the other things I really want to acknowledge today is you may have been diagnosed with a fat disorder, but a lot of times there's multiple things going on. You can have lipedema and Dercums disease as an example.
Yeah, you can.
You could have, I have a lady with scoliosis, and I can't even put it all into my notes, but and there's this underlying lipedema that she's actually just been diagnosed with. So sometimes the best thing is information. And we're going to put some additional links at the end of this video. And I'm assuming your site, can you give us some favorite reference points as to where people can find more information on this?
Well, the endotext.org book chapter, I would say, is probably one of the best places to read what I think is current about lipedema and Dercums disease. It was published in December 2019, so it's almost 6 months old, and there's new publications that have come out, so it's old already.
Awesome. But for that community, that's a real big deal for sure.
And then that's got over 200 references in it.
Right.
So I think that's a good place. My website, lipomadoc.org, Lipedema Foundation, lipedema.org. We have another website coming out called lipedema.com, and that should be up in the next 2 weeks. Awesome. Going to be a baby because we put it up for a specific reason, and but it's got the new physiology of lipedema on there, and I think that's important for people to be able to read. And it's got pictures, and then let's see where else. Dercums disease, probably my website, lipomadoc.org, and the endotext.org also has a section on Dercums disease and how I'm thinking about it and how I'm trying to tease apart the different types.
Okay, cool. Now I'm up here in Canada, and most things don't, I call us Americans. A lot of times, our medical system is influenced. We're just a state. We're about the size of California population wise, but we've got some really good advocates up here, and I look forward to, I think North America is kind of a whole as far as, access to medical services. There's a lot of interborder medical travel, and what's the next step for Karen? You've had a lot of things going on. Is there anything with your work, research, or professional otherwise that you'd like to share with us today?
I'm working towards opening a private practice, and I'm working towards starting research again in July. Awesome. So I'm about a month away before I know exactly what I'm doing, but I definitely really want to focus on research again. And also I do want to see patients because I love them and they teach me so much. And it'd be like, oh, you can't read any more papers. I couldn't live like that. I have to see people, and really they've taught me. I'm very grateful for everything they've taught me. And people say, I have a great idea. And I listen. I listen to all ideas. that's just, I think that just telling a layperson that their idea is not good when they live with it doesn't make any sense to me. So I'll definitely be announcing something hopefully in the next couple of months.
Awesome. Well, many were concerned that you were done with the lipedema world when you did make some announcements, but you know what? I've worked with a lot of medical professionals. It's just the nature of this whole body vibration I'm in, and you know, it's rare that we find someone as genuine, as passionate, and as driven. And this group is very, very lucky to have you. I'm going to be so bold as to say, as the front runner, not only doing the research and advocate, because I know research is a pain in the butt to get off the ground. It's not only the paperwork, but the funding, and it's not for everybody. You got to be a special kind of person to pursue it. And if I could reach through and give you a big hug, I had the opportunity, like I say, to spend some time with you personally a couple of years ago, and I just fell in love with you as a person. You happen to be a really smart chick, and I've learned a lot from you, and I look forward to learning more in the future.
Thank you. I appreciate that. Ditto back at you with the whole body vibration. And I will never forget that we used thermography. Do you remember that? Yeah, that was really
share if you like. I was going to bring that up with the gel thing. I'd be curious if we could test that theory.
Yeah, well, you remember I had a scorpion bite at the time.
Yes.
And we were I was on the whole body vibration machine. We're using thermography, and you could see things moving through the tissue. So that would definitely be something to look at. And then, you know, I think when you do whole body vibration, your tissue warms up. When you warm up, gels become more liquid.
Yeah.
So it's more than just the vibration. There's also, you know, heating and this new gel concept. So
and I want to encourage everybody listening today, you know, there's more positives to this technology, and, you know, information is free. So at the end of the day, you do have nothing to lose. And if you've had a bad experience with whole body vibration, some have, there's no such thing as a harmful machine. But like in your world, there's a lack of misunderstanding, not just between the machines, but how you even stand on it properly. And it's not always a pleasant experience for everyone. So I do want to put myself out there as a resource to yourself and any other groups dealing with these disorders. I just happen to have a little more experience than most. Okay.
You sure do. You absolutely do. And I think that it'd be fun to do some sort of research study together. I've been talking to people about doing something before.
Some case studies, you know, experience goes a long way too. There's a lot of ladies that are going to watch this later this week, and they're going to go, I know it works. I don't know how, I just do. And, you know, positive advocate, you know, maybe somebody else will explore what might you know, it may be for you, it may not, but it's certainly something I encourage, you know, whether you've had a good experience or hearing about this for the first time, like your information, it's just information, and I'm not here to sell anybody anything. You know, I check out everything that's come out of my mouth. And if you have any questions, I'm absolutely here as a resource, not only to your patients, Karen, but anyone just wanting a little bit more insight specific to these fat disorders.
Sounds great.
Thank you so much for your time.
You're welcome. Thank you.
Okay, and I look forward to maybe doing this again real soon.
Me too.
Thank you so much, Karen.
Bye-bye.
Don't work too hard.
You too.
Bye-bye.